Hey Guru Nation, just got off the phone. I take calls from people all the time, 949-415-6256. Someone who has not joined my CRA Academy but has been trying really hard for the last couple of years to get into the industry. She took some class somewhere else. They had an internship, but it was just shadowing other people. It wasn't like the internships at my CRA Academy where we actually have you do stuff, and your title is going to be QA assistant, QA personnel for my CRO, and we're this close to being able to start hiring our own students. So that's coming next through my CRA Academy. But I get this question asked all the time, like, "Hey," and this person, usually my response is, "You're not applying to enough places." Usually people complain after like 2 or 3 applications. This person applied to 500 and only had 6 interviews. So the issue is clearly experience. And what I told her to do in this video that you're about to see is, hey, have you tried recruiting patients for sites yet? And she said, no. Do I need my own office for that? How do I do that? And I wrote an article on this. I'm going to put the link underneath this YouTube video on how to be a patient recruiter. But that's the most entry level position you can have because it's commission only. 5 out of 10 sites are going to say yes. So you go to clinics in your area, you tell them, hey, I'm a patient recruiter. What studies do you have? And you pay me when they randomize. Okay, now 1 out of 2 will say no, but 1 out of 2 will also say yes from my experiences. And you just keep doing this, especially if you're in a big market. You have an unlimited supply of places you can recruit for. And then you have to actually go out and actually produce. So Craigslist support groups, watching the video, I actually give some strategies on how to do that. And then it's your chance to, since you're providing value for them after you do it for a while, a couple months, tell them, hey, I'm going to continue to recruit, but I also want to be a coordinator or a research assistant. And that's how you start gaining the experience. Don't give up. If you're truly passionate about it, just keep it up.
Ooh, how many jobs have you applied for?
I would say over 500.
You've applied to 500?
I've
Okay.
applied over and over. Medpage, I think I applied to almost 13 positions there. Entry level, early level. I applied to different. I even went through. You know how you go through LinkedIn and you see what CROs are offering phase one, phase two, phase three, and it
Yeah.
gives you different names. I applied through a lot of them, but I tell my story.
Mm-hmm.
I didn't start here, but this is where I am now. Give me a chance to put myself in your organization.
So what's been how many interviews have you had?
Well, the last interview I had was in Southwestern, and that was even for regulatory affairs.
But how many from those 500, how many interviews did you actually have?
Well, I interviewed initially, let me see, in the last, I'll say this year, I'll say about 6. But anytime they hear, oh, you have internship, you know what you're saying, but you don't have any experience on your
Yeah.
belt. I have to look for somebody who has up to 2 years. I'm not gonna get 2 years if nobody is
Mm-hmm.
gonna help
Why
me
don't
get there.
why don't you try being a patient recruiter for clinics near your area, and then recruit patients for them, and then get hired by them eventually, because then you'll have
Well, I
experience.
don't right, and I don't know how to go about you know being a patient recruiter. It means I have to I don't know maybe put something. But to be a patient recruiter, you have to have an office.
No.
You just call over the phone and say, "Oh,
Yeah. Yeah. You post Craigslist ads. You go knock on doctors' offices and introduce them to research. And you tell first you go to a research clinic, and you tell them, I'm going to recruit patients for you. I'm a patient recruiter. What studies do you have right now that I can recruit for? Then you take that and you go out and you post on Craigslist. You post on, I would say, Facebook if you want to spend some money, but to do it completely free, you post on Craigslist every week, every 2 weeks. You go to community events, you go to support groups, you do meetups. If there's no support group in your area for that indication, you create your own support group, meet somewhere, meet at a restaurant, do something, get the patients to come to you, and then refer them to the site. And if you keep doing that, the site's going to eventually hire you. Now you're going to get experience. Now, when you're at the site, you can tell them, hey, I really want to be a study coordinator, and I'll continue recruiting. Now you're going to be a study coordinator. Now you can apply and become whatever you want after a couple years of doing that. So that's honestly what I recommend you do.